Hi, it's Dr. Grunch. This is the post-op instruction video on a Nevro spinal cord stimulator. So we just completed your surgery. I'll send you another video kind of describing what we found, but I just want to go through the basic post-op guidelines after having a Nevro stimulator. So you'll have two incisions on your back. One is going to be right over kind of the mid-thoracic region right here. That's where we place the paddle. And the other one being in the lower part down here where the battery is. Each incision is usually about this long. It's got skin glue and a dressing on it. You can shower in 24 hours. Once you take a shower, you can peel that dressing off and have a family member just check it to make sure there's nothing concerning drainage-wise or redness or swelling or anything like that. For the first 24 to 72 hours, the first 1 to 3 days, you can ice that incision to prevent swelling. You want to ice it for 30 minutes, 3 times a day on each incision, just to make sure that the swelling is not significant. Just keep it clean and dry. You can take the medications that I have prescribed you for pain or that you take from your pain doctor. I will have talked to you about that at the time of surgery. Sometimes I'll also prescribe a muscle relaxer that'll help that incisional pain right at that area in your mid-back. That muscle, that's where we cut the muscle, so that's going to be pretty sore. I usually put a medicine called Exbril, which is an extended release numbing medicine on your back too that'll kind of wear off over the next few days, so it might be a little sore. You can take also over-the-counter anti-inflammatories. Ibuprofen or Advil is totally fine as long as it's safe for you to take these medications. I will send you a separate video from Amy from Nevro that'll kind of go through the guidelines of what she'll talk to you about in terms of getting the stimulator programmed. If I did leave any stitches in place, we will make you an appointment to take those out, but normally I do not. Restrictions, you don't want to do any heavy lifting, so don't pick up anything more than 10 pounds. Try not to do a lot of bending, and that's for 6 weeks. We want to let that paddle heal into position. We don't want it to slide or move. The biggest concern about this surgery is making sure that the stimulator paddle does not shift at all. So any kind of fall or sudden jolt or pull could potentially disrupt that lead. So those are the things you need to avoid for the first few weeks. The other thing is I use a company called Inhabit Home Health. You may get a phone call from them. They'll come out, check on you, and show you some things to do at home. You don't have to have them come out, but that is an option for you, and your insurance company should cover that. If you have any questions about your incisions, swelling, drainage, fevers, anything like that, I need to know about it. You'll have a post-op visit in my office, and usually 4 to 6 weeks with one of my physician assistants who will check you and make sure that everything is good. If there's any trouble with coverage of your lead after surgery, meaning that the stimulator is not covering your pain or anything like that, we will get x-rays. Otherwise, we don't usually get x-rays unless you're having any concerns or anything. I really hope that this surgery will bring you some relief of your pain.